I am going to perform the skill of sterile dressing line change. First, I'm going to review my order and verify my facilities protocol. I'm going to identify my patient. I'm going to provide for privacy, and I'm going to explain the procedure to my patient. I'm going to perform hand hygiene and don PPE. I am going to place a mask on myself, and I'm going to position my patient appropriately. If he has a PICC line, the PICC line must remain above the heart. I'm going to apply a mask to my patient, and if there's any visitors or family members that don't want to leave the room, they also have to apply a mask. Again, I'm going to perform hand hygiene. I'm going to put on clean gloves. And I'm going to remove the old dressing. Mr. Doe, it's been a week since we changed your dressing. I'm going to remove the old dressing and apply a new dressing. As I remove the old dressing, I'm going to assess the site for signs of infection, redness, drainage, poor sense. I also do have Mr. John Doe verify his birthday, 5/9/90 with my medical record. I am going to set up my sterile field at this time. I discarded the old dressing. His site is clean, dry, and intact with no signs of infection. I'm going to open my sterile dressing kit, remove my old gloves. Scooby would not contaminate my sterile field. I'm going to apply my sterile gloves after performing rigorous hand hygiene. I'm going to also ask my patient if he has any skin allergies to adhesives or iodines. Get my gloves sterile. I would not touch that in real life because I'm keeping a sterile field. Okay, I have my sterile gloves. I'm going to discard. And now I'm going to clean from the inner port to the site of insertion outward, 3 inches in circular motion. Drop, get a new one, clean, drop, get a new one, drop. And I would allow that to dry without air motion. This glove is contaminated because I held the port with that glove. So I'm going to apply a protective coating per facility protocol before applying the dressing. And I would also change my stat locks at this time. And I'm going to apply the dressing. Since I have contaminated this hand, I would not use it. I can use it on a place that's not going to touch my patient. I'm going to place the dressing, remove the excess, discard, I would keep a sterile field so my patient normally wouldn't fall off of the bed. I would date, time, and label, and I did mess my sterile field up. Date, time, and label, and in 1 week we would change the dressing again. I would perform hand hygiene and document my procedure.